Your doctor told you to watch what you eat. You cut the sugar. You cut the bread. You even gave up your evening dessert. But nobody, not your doctor, not the nutritionist, not anyone, told you that what you are pouring into your morning coffee or your breakfast cereal might be quietly pushing your blood sugar in the wrong direction every single day. And here is what makes that even more frustrating. For most people with type 2 diabetes over the age of 60, the answer is not to cut milk out completely. The answer is to choose the right one, because the wrong milk, especially the ones marketed as healthy, can spike your blood sugar just as badly as a slice of white bread. But the right milk, used the right way, can actually help your body manage glucose more steadily throughout the day. I have spent 30 years sitting across from patients who are doing everything right and still struggling. And one of the most overlooked pieces of the puzzle has always been this: what they are drinking with their meals, not just what they are eating. Today, I am going to walk you through the 5 best milks for type 2 diabetes, ranked from a solid, dependable option all the way to number 1, which is not a brand and is not expensive. It is a strategy backed by some of the strongest clinical research I have seen in this space. And if you have diabetes or pre-diabetes and you are over 60, you will want to stay until we get there, because the way you have been drinking milk your entire life may be the one thing working against you. My name is Dr. Albert. I have been practicing internal medicine and metabolic health for 30 years. In that time, I have treated thousands of patients living with type 2 diabetes, men and women in their 60s, 70s, and 80s who came to me confused, overwhelmed, and sometimes just plain exhausted from managing this condition. What I have learned over those 30 years is that the small daily choices, the ones that seem too simple to matter, are often the ones that move the needle most. What you drink at breakfast is one of them. If this is your first time on this channel, welcome. My goal here is simple. I want to give you clear, honest, research-backed information so that you can make better decisions for your health every single day. Not scare tactics, not miracle cures, just the truth explained in plain language. If that is what you are looking for, make sure you subscribe so you do not miss what we are covering next. Now, let us talk about milk and blood sugar, and let us do it right. Here is something most people do not realize until it is explained to them. Milk, all milk, contains carbohydrates. The natural sugar found in cow's milk is called lactose. And carbohydrates, whether they come from bread, fruit, or a glass of milk, are exactly what raises blood sugar. That is not a reason to panic, it is just biology. But it is something every person with type 2 diabetes needs to understand, because not all milks carry the same sugar load, and not all milks trigger the same response inside your body. After the age of 60, managing blood sugar becomes harder, for reasons that have nothing to do with your willpower or your effort. Your insulin, the hormone responsible for moving sugar out of your blood and into your cells, becomes less efficient. Researchers call this insulin resistance, and it tends to worsen with age. Your pancreas also produces insulin more slowly as the years go by. That means the same glass of milk that your body handled easily at 40 may cause a steeper blood sugar rise at 68 or 74. This is not your fault. It is physiology. According to the American Diabetes Association, people with type 2 diabetes are at significantly higher risk for cardiovascular disease, nerve damage, kidney decline, and vision loss, all of which are made worse by chronically elevated blood sugar. Studies have consistently shown that even modest improvements in post-meal blood sugar management can reduce these long-term risks meaningfully. And what you drink with your meals is a part of that equation that most people are not paying attention to. Let me be absolutely direct with you. No milk on this planet reverses type 2 diabetes. Anyone promising you that is misleading you. But choosing wisely, and I mean specifically and intentionally wisely, can take real pressure off your glucose control every single day. That is what this video is about. To understand why some milks are better than others for blood sugar, You need to understand how your body processes a meal after 60. Think of your bloodstream like a river. After you eat, sugar from your food flows into that river. Your insulin is like a crew of gates along the riverbank, opening up to let sugar move out of the river and into your muscle cells where it can be used for energy. In a healthy body, the gates open quickly and efficiently. In a body with type 2 diabetes, especially after 60, those gates are slower. They are stiffer. The river fills up faster than the gates can drain it, and your blood sugar climbs. Now here is where milk becomes interesting. Milk contains not just carbohydrates, it also contains protein. And protein has a powerful effect on that river. When protein enters your digestive system alongside or just before carbohydrates, it slows down how fast the carbohydrates are absorbed. It also triggers hormones in your gut that signal your pancreas to release insulin earlier and more efficiently. The river does not fill up in a sudden rush. The sugar trickles in slowly. The gates have time to keep up, and your blood sugar stays steadier. This is why the type of milk you choose matters enormously. Some milks are mostly carbohydrate with very little protein. Those flood the river. Others are high in protein with less sugar. Those slow the flow. And one specific way of using milk has been tested in clinical trials on people with type 2 diabetes and prediabetes, with results that genuinely surprised the researchers. We will get there. Let me walk you through the 5 best milk choices for type 2 diabetes, starting with number 5 and building all the way up to the single most powerful approach the clinical evidence points to. Number 5. Lactose-free cow's milk and ultra-filtered high-protein milk. This is the place to start if you love dairy and do not want to give it up. And I want to make the distinction between these two options clear because they work differently. Lactose-free milk is regular cow's milk with the lactose, the natural milk sugar, pre-broken down by an added enzyme. The sugar is still there, but your digestive system does not have to work as hard to process it, which matters more and more as digestion slows with age. The blood sugar impact is similar to regular milk, but the digestive comfort is often significantly better for people over 65. Ultra-filtered milk, the kind sold in high-protein cartons, is different. These milks physically filter out a portion of the lactose while concentrating the protein. So you end up with more protein and less sugar in the same glass. And that matters because protein, as I explained, is your blood sugar's natural speed bump. The research here is compelling. A 2018 study from the University of Guelph and the University of Toronto, published in the Journal of Dairy Science, found that drinking milk with a carbohydrate-based breakfast actually lowered post-meal blood sugar compared to drinking water with the same meal. And crucially, higher protein milk lowered it even more. A 2019 study published in the journal Nutrients found that concentrated dairy protein, specifically whey, produced a statistically meaningful drop in HbA1c, that is, your 3-month average blood sugar, in people with prediabetes. The protein in milk is doing real work, and ultra-filtered milk gives you more of it per glass. Here is what to do today. At your next grocery trip, pick up 1 carton of unsweetened, ultra-filtered high-protein milk or lactose-free milk and read the label. You want protein high, ideally 8 grams or more per serving, and sugar as low as possible. Use it exactly where you already use milk. This one swap costs you nothing extra and gives your body a better tool. If you want to multiply this benefit, use this milk the way I will describe at number 1, and what a solid choice becomes genuinely powerful. Number 4. Plain kefir and unsweetened drinkable yogurt. This one surprises a lot of my patients the first time I bring it up. Kefir is fermented milk, and fermentation changes everything. Here is the mechanism in plain terms. When milk is fermented, live bacteria consume a significant portion of the milk sugar before the drink ever reaches you. So fermented dairy products tend to land more gently on your blood sugar than the same volume of plain milk. But that is only half the story. Those same bacteria, your probiotics, survive into your gut, where they actively shape how your body handles glucose and inflammation over time. Why does this matter, especially after 60? Because research consistently shows that the diversity of beneficial bacteria in your gut decreases with age, and that decline is directly linked to worsening blood sugar control and increased systemic inflammation. Inflammation, by the way, makes insulin resistance worse. So anything that supports a healthy gut environment is working on your diabetes from a completely different angle. A randomized controlled trial examining probiotic-enriched fermented milk in people with type 2 diabetes found meaningful improvements in both glucose markers and inflammatory markers over an 8-week period compared to a non-probiotic version. Large observational studies have repeatedly linked regular yogurt consumption to a lower risk of developing type 2 diabetes in the first place. Start today with this. Buy plain, unsweetened kefir, not the flavored variety which can contain more added sugar than a soft drink. The ingredient label should be short. Look for the word unsweetened and look for live active cultures. Have a small glass with one of your main meals. Your gut will notice the difference within weeks. Number 3. Unsweetened almond milk. If you are not a dairy person, or if dairy simply does not sit well with you anymore, this is the easiest switch you can make. And its advantage is almost embarrassingly simple. Unsweetened almond milk has less than 1 gram of carbohydrate per 100 milliliters. For comparison, regular semi-skim cow's milk has around 5 grams per 100 milliliters. When there is almost nothing to raise your blood sugar stays almost flat. That is the whole mechanism. Less sugar going in means less sugar your body has to manage. A 2023 systematic review published in the journal Nutrients, examining plant-based milk alternatives and blood glucose response, concluded that low-carbohydrate options like unsweetened almond milk have minimal impact on glucose levels. That lines up exactly with what the nutritional analysis tells us. But, and I want to be direct about this, the word unsweetened is doing enormous work in that sentence. Flavored almond milks, vanilla almond milks, and sweetened varieties can carry just as much added sugar as a soft drink. That label check is not optional. There is one honest caveat tied to age. Almond milk is naturally very low in protein. After 60, your body actually needs more protein than it did in your 40s to maintain muscle mass and protect your mobility. So unsweetened almond milk is an excellent low-sugar base for your coffee, your tea, your cereal, but do not rely on it as your main protein source. Pair it with the milks higher on this list if you want the full picture. Start today. Replace the milk in your morning coffee or tea with one unsweetened almond milk. It is widely available, affordable, and your blood sugar will see the difference in your daily readings. Number 2. Unsweetened soy milk. This is, for most of my patients with type 2 diabetes over 60, the single best all-around choice in the milk aisle. Here is why. Unsweetened soy milk pulls off something very few plant-based milks can manage. It is low in sugar, around 2 to 3 grams of carbohydrate per 100 milliliters, and yet it delivers a complete, high-quality protein comparable to what you find in animal products. Most plant milks are either low sugar but low protein, or higher protein but higher sugar. Soy manages both. That combination, low sugar load with a high protein hit, is exactly what a body with type 2 diabetes needs. Now, let me be honest with you about the evidence on soy, because honesty is the entire foundation of what I do. A 2021 meta-analysis in the journal Nutrients, pooling results from multiple randomized trials, found that soy did not produce a large, reliable drop in fasting glucose or HbA1c on its own. So soy milk is not a blood sugar miracle. I will not tell you it is. But that same body of research found something else that I believe is just as important for anyone over 60 with diabetes. Soy consistently and significantly lowered total cholesterol and LDL, the harmful cholesterol, in study participants. And a separate randomized controlled trial found that soy protein improved HbA1c compared to dairy casein protein over an 8-week period. Why does this matter? Because the number one cause of death in people with type 2 diabetes is not diabetes itself, it is heart disease. Soy milk works on the organ diabetes puts most at risk. When you choose unsweetened soy milk, you are steadying your blood sugar and protecting your heart at the same time. In 30 years of practice, I have never found a reason to argue with that combination. If you are not already subscribing to this channel, I want to ask you to do that right now. My goal is to give you the kind of clear, specific, research-based information that actually helps you age with more strength and fewer surprises. Hit subscribe so this kind of content keeps coming to you. Start today. Choose unsweetened, fortified soy milk. Fortified means calcium and vitamin B12 have been added back in, which matters if you are using it to replace dairy. Use it everywhere you would use regular milk. And now, number 1. This is the part I have been building toward the entire video, and it will change how you think about every glass of milk from this point forward. Number 1. The protein preload, drinking the right milk at the right moment. Number 1 is not a brand. It is not a special ingredient. It is a timing strategy, and it is supported by some of the most compelling clinical evidence I have reviewed in the area of blood sugar management. Here is the concept. Before you eat the carbohydrate portion of a meal, your toast, your oatmeal, your bowl of cereal, you drink a small glass of unsweetened high-protein milk, dairy or soy, about 150 to 200 milliliters, about 10 minutes before you eat. Researchers call this a protein preload, and here is the mechanism in plain English. When protein hits your digestive system a few minutes ahead of carbohydrates, something specific happens. Gut hormones are triggered, particularly GLP-1 and GIP, that do two things simultaneously. They slow the rate at which your stomach empties, which means carbohydrates absorb more gradually into your bloodstream. And they prime your pancreas to release insulin earlier and more efficiently, so your body is better prepared to handle the glucose before it even arrives. The result is that instead of a steep spike in blood sugar after your meal, you get a gentler, slower rise that your insulin can actually manage. The research on this is the strongest on this entire list. A 2014 randomized controlled trial published in the Nutrition Journal gave participants a modest whey protein drink before a high-carbohydrate breakfast. Their peak blood sugar dropped by approximately 2 millimoles per liter, and their average glucose over the following 3 hours was meaningfully lower, all from one small preload taken before eating. The 2018 study from Guelph and Toronto confirmed the pattern specifically with milk. Higher protein milk consumed at the start of breakfast produced lower post-meal glucose and steadier blood sugar. Not just after that meal, but measurably so after the next meal hours later. One smart glass of milk, working long after the cup is empty. This matters most after 60. As I explained earlier, the early insulin response, the first wave of insulin your pancreas releases when it senses a meal coming, weakens naturally with age. A protein preload nudges that early response back into action. It is not a drug, it costs nothing extra, and it works with whatever you are already eating. I want to tell you about a patient I will call Raymond. Raymond came to see me at 71, a retired school principal who had been living with type 2 diabetes for 9 years. He was diligent. He took his medication without fail. He had cut out desserts, reduced his portions, and walked every morning without exception. But his morning blood sugar readings were still climbing, and he was frustrated in a way that I recognize immediately in long-term patients. The kind of frustration that comes not from laziness, but from effort that feels invisible. When I sat down with Raymond and went through his entire morning routine, everything was reasonable until we got to breakfast. He was eating plain oatmeal, which is not a bad choice, with a large glass of orange juice and a cup of coffee with regular 2% cow's milk. He had been doing this for years because he believed it was healthy. And in isolation, none of those things is terrible. But together, and in that sequence, He was giving his blood sugar a perfect storm every single morning. Fast-acting juice sugar, the carbohydrates from the oatmeal, and the lactose from the milk, all arriving in his bloodstream within the same narrow window. We made 2 changes. We replaced the juice with water, and we changed his routine so that he drank his coffee, now with unsweetened soy milk, about 10 minutes before he sat down to eat his oatmeal. That was it. Same oatmeal, same kitchen, same morning routine. Just the order changed and the milk choice changed. Within 3 weeks, Raymond called my office to tell me his morning readings had dropped consistently by 15 to 20 points. He said, "Dr. Albert, I have been fighting this thing for 9 years and nobody told me the cup of coffee matters more before the oatmeal than with it." That is not a miracle. That is biology. And it is available to you right now, starting tomorrow morning. Let me bring everything together into simple actions you can take today. First, check the label on whatever milk is currently in your refrigerator. Look at the carbohydrate content per serving and the protein content per serving. That ratio tells you everything. You want protein high, sugar low. Second, if you drink flavored or sweetened plant milks, switch to the unsweetened version immediately. This one change alone removes a hidden daily sugar load that most people with diabetes never account for. Third, try the protein preload starting tomorrow morning. Take your morning glass of milk, unsweetened soy or high-protein ultra-filtered dairy, and drink it about 10 minutes before your highest carbohydrate meal of the day. Do not change what you eat. Just change when the milk comes relative to the food. Watch your readings for 2 weeks and see what happens. Fourth, if dairy disagrees with you or leaves you uncomfortable, plain, unsweetened kefir is your best friend. Start with a small glass with 1 meal per day and give your gut 4 to 6 weeks to respond. The improvement in digestion and inflammation is real, but it takes time. Fifth, and I want to be very clear about this, none of what I have shared today replaces your medication, your doctor's guidance, or your existing treatment plan. If you are on insulin or diabetes medications, talk to your physician before making changes to your diet. The goal is to add smart habits on top of what you are already doing, not to replace medical care. These are tools to support your body, not substitutes for your doctor. Here is what I want you to remember when this video ends. Managing type 2 diabetes after 60 is not about perfection. It is not about deprivation. It is about making better choices with the information you actually have. And what you pour into your glass every morning is one of those choices. One that is entirely within your control, costs almost nothing to change, and can quietly make your blood sugar steadier every single day. You deserve that steadiness, not just for your glucose numbers, but for your energy, your independence, your mornings, and your peace of mind. The small things add up. The right milk, the right timing, the right habit repeated. That is how you slow this condition down and take some power back. Now I want to hear from you. Drop a comment below and tell me, which one of these 5 milks are you going to try first? Or, if you have already been drinking one of them, tell me what kind of difference you have noticed. I read every comment, and your experience helps the next person who finds this video. If this gave you something clear and useful today, please share it with someone you love who is managing diabetes. Because the people in our lives do not always know what they do not know. A 5-second share from you could change their mornings. And if you are not already subscribed, please do that now. Every week, I bring you honest, specific, doctor-explained health information for people in their 60s, 70s, and 80s, because your health deserves that level of attention and respect. Coming up next, we are going to talk about another daily habit that people with type 2 diabetes do almost automatically that is working directly against them. And the fix is simpler than you would expect. You do not want to miss it.